Live. It's the last week of Stroke Awareness Month, and Methodist Healthcare has an important message for you. Be fast. Today we learn how to spot the signs of a stroke, bust a few myths, and find out when to go to the ER. Dr. Azaz Handal is a neurologist with Methodist Hospital, Stone Oak. Welcome. So let's start with, what is a stroke and how can you spot when every second counts?
Absolutely. One of the most important things is to know the acronym, which is a clinically sound tool, Be Fast. It's important to know that because that's how you understand and know what the stroke is. B stands for balance. Anytime you have coordination difficulty or dizziness, that could be a warning sign. Second part, E, which stands for eyes. If we have sudden loss of vision, one or both eyes, it can also mean a sign of an early stroke. Then F stands for face. If somebody has a quick facial droop, one side or the other, that could also be a sign of an emergent situation. Same thing with the A stands for arms. So you have them raise arms. If one side they're not able to lift or move, that could be a sign of a stroke. And S stands for speak. If they're not suddenly able to talk, they can't talk properly, can't speak properly, that's also a warning sign. And T is very important, it's time. Time is of the essence. So call 911 and get the emergent care, because that's how you get the best clinical outcomes.
Yes, even if you aren't sure if it's any of the symptoms related to a stroke, you should still, just to be safe, right?
Absolutely. We always guide our patients, never brush off your symptoms. Always take them very seriously.
Okay, now what if symptoms improve after a few minutes? Do they still need emergency care?
Yes, without a question. It's very important to understand that sometimes patients could be having what we call transient ischemic attack. In other words, you might hear it's called mini stroke. It could be a lot of times a transient blockage in blood flow to your brain. So it's important to recognize that sometimes that could be a warning sign of a major stroke. Sometimes patients feel certain symptoms and they improve. You should not ignore that. If you ever develop transient symptoms, even they sound minor, you should call 911. Get to our Methodist ER. We provide 24/7 stroke care. We'll be happy to take care of you.
All right, great advice. Now, what is one stroke fact that often surprises people?
One of the most common things that we encounter, we have to remember that strokes don't only happen in older population. They can happen at any age. We commonly see nowadays younger people having strokes. So it's very important to control any risks, factors that could be linked to stroke, such as diabetes, hypertension, high cholesterol. So it's very important to recognize those things. And it's also important to know that this could be your brain's way of giving you a warning. So it's important to understand that it's what to look out for. Call 911, and that's the key. You be fast, act quickly, because that's going to really help preserve your brain health.
And listen to your body. It's giving you all the signs, right? And lifestyle plays a role. So what can we do to prevent a stroke?
It's a great question. I think for the most part, having an overall good lifestyle modifications, trying to have a good diet, a very balanced routine. Mostly we tell patients to have a Mediterranean diet. Try to limit your saturated fats, trans fats, increase your amount of intake of vegetables, increase your fruit intake. Also try to avoid red meat, and also things like avoid smoking, limit your alcohol intake, do some good moderate aerobic exercise up to 50 minutes a week. Those are really good things that you can do. And last but not least, you should also control your underlying risks. If you have hypertension, you have high cholesterol, you have high sugar levels, it's always important to control those things.
Thank you so much for all of that information. And you can see right there if you need more information, sahealth.com/ER. Thank you, doctor.
You're welcome. Thank you.